And in case you're going through any phase of depression, any phase of it, to a point where you feel suicidal, I have the National Suicide Prevention Helpline here that I'd like you to write down. Maybe not for you, it could be for a friend. Somebody might need it. Then this is a toll-free number. The number is 0800-678-678. 0800-678-678. And this is the National Suicide Prevention Helpline. Now I have another question. The question is, how does depression affect one's health, your health in general?
Okay, so it's been realized that depression actually worsens physical illness. Okay, so the first thing I said from the beginning was that depression makes you dysfunctional. Okay, so someone is working well, they're able to take care of their families well, they're even taking care of themselves well, and now it's all going down. Clearly there's something wrong. So definitely it affects how you function. Okay. Then it also affects your physical health, in the sense that for someone who is hypertensive or has maybe some other form of cardiovascular problem, yes, or has diabetes or has any condition at all, even a stroke, if they suffer depression around that same time, if they have depression, it worsens the outcome of the physical illness. You understand? Yes. And that is how we can't, that is why it's so important to get help early, okay? Because as you're able to manage the depression, the physical illness could also get better, okay? And there's one thing we haven't said so far. What it is that when it comes to depression, there are also physical causes, there are medical causes of depression. Okay. Okay, so someone could have a thyroid problem, and it could actually present as depression. You understand? So hypothyroidism can present as depression. Yes. And that is why it's so important to go to the hospital, because in that particular case, if you're able to manage the thyroid problem, the depression will be okay. Sure. And there are other causes, other medical causes of depression.
Okay. Let me share with you a story. Sure. So this thing happened after first year of medical school. We have this like a month where we do like nursing training. So we go to the hospitals and then we work as a nurse. Yeah. So I was now, in the medical sector, but then I realized that there was this old lady. She was being managed for a chronic illness. I don't remember the diagnosis of her now. Okay. But then, so she had been there for maybe 2 weeks before I came, but then her vitals were going on fine. The treatment was going on well. And she wasn't getting so, exceedingly better, but then she was stable. Okay. So one day, I came to work, and then her mood was down. And then, I overheard some people saying, oh, she has sort of given up. So the next day, so she sort of gives up today. The next day, she dies. And then, so this is after first year of medical school. Then when I became a doctor, I realized that now, when people stop fighting an illness, the rate of deterioration of their condition is so dramatic. They could sort of give up in the morning, and you could literally see it. Yeah. You see a patient who's been fighting maybe cancer, fighting a bad illness for a long time. Yeah. And then one day you come, they are depressed, they are sad, they could die maybe in the evening or overnight. And I've seen it happen over and over again. It for me strengthens the belief that the mind is sort of like a master organ to the body. Correct. If your mood is stable and high, then you are able to even fight even common disease like malaria. Yes. But if you are down, then even something as small as common as malaria will be able to defeat you.
Which means depression actually takes a negative toll on your psychological well-being. Yes. And when that happens, you can give up that easy.
Yes, you can give up that.
You can just go like that.
Yeah.
That's amazing. This is a new thing that I've learned today. I never really connected that dot, but yes, I've learned that today. So with this being said, that women, we suffer more. Yes. I know men do too.
Yes, we do too.
Now, the reason why the number in men is that
more resilient.
It's because men tend to act like I'm so strong, and even if they're battling something, they're like, I'm a man, I gotta man up. And you're dying, but you're manning up, dying. So,
that's
so if you're a man, just because we women suffer it more doesn't mean that what you're going through might not be depression. It could be. You got to see a doctor. Maybe not me, but you have to see a doctor.
No, I think men we have a problem, and society has a problem.
Okay.
And our women have a problem. Because, you see, the society gives us pressure to be men. Our women give us pressure to be men. Imagine a man comes to tell a woman, you know, I'm depressed. What would the woman think of the man?
Sure.
So that pressure alone pushes the man to hide it. Okay. Because he won't also want that case where the society that's looking up to him to stand up and be a man, you know, be strong, you know, a man doesn't cry and he wants to cry. How can he cry? He has to hide the crying. You know,
you're a man, you can't cry.
You can't cry. You see, so it's a society we've created based on perception.
Yes.
So that perception coupled with a stigma drives the illness into secrecy. So much so that they suffer in secret to the point that it's like you've opened the tap into like a bottle, and after a point it begins to like overflow.
Correct.
So when it begins to overflow, then they take their lives. And you know, women tend to get more depressed than men. However, men are more successful at suicide than women.
Yeah.
So when a man decides that he's going to commit suicide, he actually does it. You know, when a woman decides they're going to commit suicide, she will draw attention. Hey,
we can brood over it for years.
Come and see me. Come and I'm going to die. But I'm ready to say, come and see me. I'm going to
just go silent.
Yes.
So if you're a man, I know you have to be strong, but you can be strong when you're dead. You have to try and fix it. So just because the society have this stigma around men that you're supposed to be strong doesn't mean that when you're hurt and you keep it inside, you have to talk to someone. And that's where the saying goes that we all need somebody. So if it's getting worse, please see a doctor rather than, we need you alive rather than dying. But I'm hoping that we're all learning something from this. This subject is really broad and it's so huge. We could go on and on and on. I don't think we can take this in just one episode. So we're gonna go for a commercial break and then we'll come back. Welcome back from the commercial break. It's still me, your host, Dr. Ann Sansa DALY. So, like I did mention before, depression is a broad subject. We're just trying to break few down because if we want to do this, we're going to have to come back on another episode. So, we've already spoken about the psychological aspect of it. We want to go social now. So, we know that in relationships, depression actually does set in sometimes to a point where people break up and some even take their lives. Do you have anything to add on to that and what we can do to actually avoid getting to that level?
Okay, so I think currently it's one of the commonest causes of suicide, among the youth. So you have strong men and women trying to die because maybe they suffered a breakup in a relationship. Maybe someone they really were attached to, they felt they were so much in love with, had to leave them, or something of the sort, and then it leads to depression. But you know what, at the point where someone starts talking about suicide or taking their life or how sad they are or how they want to kill themselves because someone left them, that person needs help. Okay, and if the help does not come, then the person might succeed in killing themselves. So this is really a clarion call to loved ones, to friends, to family. If you have any friend who suffers a breakup in a relationship and you can tell that it's affecting them so much that they keep saying that they want to kill themselves, please do something quickly about it. Take them to the hospital. Okay, don't just maybe suggest to them that they should go to the hospital. Actually hold their hand and take them to the hospital for them to get help, because they could succeed at actually dying by suicide, and that is something we don't want. At that point in time, they are not mentally stable. Okay.
Yeah.
I mean, whatever happened has hurt them so much that they want to end their lives. It's not a very mentally stable place to be.
Correct.
So when they start talking about all these, please don't laugh at them. And I know a lot of youth do that. A friend of theirs, they just laugh and make fun that you are not strong enough. This person left you and you want, and they just make a lot of fun. But it's not really funny.
It's more mental.
Exactly, because at that point, they are not well.
Okay.
And they need professional help. So please take them to because we see that a lot, that someone has done something to kill themselves. Sometimes such cases actually present on the surgical ward. Okay. They go and drink acid, yes, or something to end their lives, and they end up with a stricture in the esophagus, and they have to present to the surgeons to perform surgeries on them. You understand? Yeah. And in that case, it may even actually be good because they did not succeed. And that is how come they ended up at the surgical ward. But sometimes they actually do succeed. And then we end up losing, very vibrant youth to suicide, all because of depression.
Dr. Honey, do you have anything to add to that?
Yeah, I think we've seen quite a lot. For me, when I was at KNUST, people used to, climb very tall buildings and just jump. Yeah, so especially so with relationship breakups, I think from my experience, the men are not able to handle it. It seems so. Usually, the women have they suffer immediately. The first 2 or 3 days, they are broken down, but after a week they are fine. Then the reverse happens for the guys. In the first 2 or 3 days, they have to prove that I'm not affected. I'm not affected. I'm a man, and smile. After 1 week, after 2 weeks, then they collapse.
Reality sets
yes,
in.
and I think we are not really built for emotions.
Okay.
So when the emotions hit in and it sweeps him off his feet, he's gone. And if you don't have a strong brotherhood or a strong church or a strong social system to sort of bear you up in that weak time, anything is possible. And also because we have a lot of influx of these foreign movies that sort of give us ideas.
Yes.
You watch Romeo and Juliet, you listen to songs about breakups and what someone did when his heart was broken, and you watch all these movies. When people get breakups, they try to drink this or try to eat that or try to. So now we are having people trying out all these ideas. Right. Some would binge drink and then drive, because maybe they can't by their own will kill themselves,
Correct.
but they can kill themselves when
they need that aid.
Yes, so maybe they are drunk, but they'll drive at maybe 200. So whatever happens should happen. Some would probably get stabbed themselves. So as she said, some would present to the surgery or to the surgery ER as a result of that. Yes. So I think that generally we are having an increase in such cases, and also because of social media.
Yeah.
Okay, there's a lot of social media brings a lot of comparison. So maybe this person was in a relationship and then he has an image of what a relationship should look like.
Correct.
So if he sees someone on social media, Facebook, Twitter, etc., and then he has this couple in mind, couple goals, relationship goals, how they should roll, how everything's supposed to go. So when that crashes, his perception of how the world should be also crashes. Yeah. And when those two crash, then he really has no more motivation to live. Correct. Yes, and when that's gone, then all he has left is to find the will to end his life. Yes. Yeah.
Okay. Well, looks like social media has also created this perfect perception.
Yes, this perfect perception
of how life should be.
Yes,
and generally, we all want to be like the other person because they've presented this to us. So I keep telling people, there's no way I'll cry and make a video and come put it online for you to see, but I cry. Yeah. Everybody's showing the happy part of their lives. Yeah. So if you compare your reality to someone else's social media lifestyle that they're given, somebody's social media relationship, for all you know, that happiness you're seeing is just in photos, but not at home. Yeah. And in reality, that is really what is happening. A lot of those couple goals you see, trust me, it ends right in that photo. The moment we got done with our photo, we fought and went to bed in separate bedrooms. And you are sitting out there watching all these things, and your relationship didn't work out. You think someone else's perfection is supposed to be how yours end, so you want to die.
You know,
that's a problem.
Largely, the highest group of people who are prone to depressions within the age of 15 to 29.
Okay.
It's almost coincides with the age at which you are prone to peer pressure.
Correct.
So the more you have that societal peer group influence and pressure, the more prone you are to being depressed. Because there's that constant comparison.
Yes.
Okay, my best friend, you know, he found a lady and it went this way, it went smoothly. How come I'm struggling? Maybe it took you a long time to land one Mercedes Benz, and then you drive the Mercedes Benz across the street and it breaks down. That 15 to 29 is really the high. That is like an age of comparison.
Okay.
It's an age where you are more prone to look at the context of your life from other people's context. Yes.
And it's also the same age range where you have a lot of suicides.
Okay.
Yes. So I just wanted to mention something. He mentioned it in passing. One other social cause could be, like you said, peer pressure. And in this case, we're talking about the use of substances, psychoactive substances. So alcohol, all the other substances that you can think about, okay. These are psychoactive substances, and usually they have the ability to alter the chemical composition of your brain, of your mind.
Yes.
You know, and all these, we are talking about depression, bipolar, the mentally related conditions. They come about because there's chemical imbalance in the brain. Okay, so I think that the youth should be educated on some of these substances. They should be careful the way they are drinking, the way they are smoking, and some of these, behaviors, okay? Because you may be smoking today, but tomorrow it could land you in another place you don't want, okay?
So when you say smoking, is it limited to specific?
No,
substances
so
or
usually,
any?
yes, it can be nicotine, it can be marijuana, any of the other substances.
Gotcha.
But the thing is, the youth tend to compare themselves with or to other people. So they know this person is smoking, nothing is happening to the person. But like we said, mental conditions, they are biopsychosocial. Maybe your biological makeup predisposes you to some form of mental illness. Then you go and add on smoking to be on the safer side. Just don't do it, okay? And I'm saying this because there's help available. So at a point where you think you need help to stop, maybe you're trying to stop, you read about all the side effects it could bring you, just come to the hospital, okay? Go and see a psychiatrist, okay? And a lot of our hospitals, the major hospitals are trying to create psychiatry units. So just go to the hospital and get some help. Another social factor that could predispose a person to depression is people who have suffered adverse life events, okay? So abuse, anything which does not put you in a position to be mentally stable or sound. Okay. So someone has suffered physical abuse, even verbal abuse. Someone has suffered some form of sexual abuse. All these are very important. And sometimes as a society, as a culture, we try to hide some of those things. Okay. But you can just take the victim to the hospital so that they can get some psychological help. Because sometimes it tends to, linger in their minds and it affects them all their lives through. So for such a person, if something else should come into the picture, they could just go to zero. Their mood could just dwindle and then they could suffer depression. Let's also check the environment we raise our kids. Abuse is not safe for any child. The child may not be able to voice it out, but it's not safe for any child. So let's be careful. Some of the people around us, let's be very careful as parents, as guardians, as aunties, as uncles, as adults. Okay, let's keep an eye over the kind of influence people around us have. And let's help people out of some of these adverse situations.
All right, I think you actually went ahead to answer my last question. I was going to ask how loved ones can actually help their family and friends they notice are suffering depression. Because, like I said, as I sit here, I might be going through depression. You might see it. It's my willingness to go to the hospital, or my willingness to listen to you, because I don't want to hear you out. What do you mean I'm suffering from depression? And in a case like that, I mean, you see it because you have knowledge. Like if you're watching me, at least you have an idea of what we're talking about. And you think a sister of yours is going through this. And you talk to her and she's like, I'm not suffering from depression. What can a loved one do in a position like this? What do they do to help out?
So I think for me, the first stage is to talk.
Okay.
But the first, so in having a conversation with a person, the first thing to expect is a block.
Okay.
So usually people block away people. So then you'd have to be very patient with them, yet very persistent, and also very caring. So a consistent approach, trying to find out what the problem is, usually is able to cut through that blockade.
Okay.
Sometimes you are still not able to do so. Now, where you are unable to do so, then you could sort of create an environment where a professional comes in.
Okay.
Or call, so sometimes you could call in someone that person really respects. Everybody has a hero, everybody has a role model, or everybody has a mentor. So you could sort of get that person to have a conversation with that person. And then through the conversation, I mean, conversations are one of the basic ways to deal with mental issues.
Okay.
It's called psychotherapy,
Okay.
but it's in varied forms.
Correct.
But at the basic level, you start a conversation, and then through the openness of that conversation, you can guide the person to help. Okay. So the conversation would tell you, or would open up to you, the varied means of aid you can help the person with.
Okay.
Ultimately, if it becomes very challenging, you will have to bring the person to the hospital. But sometimes it could be a medical condition, and so much so that the person is unable to make a mental assessment that the person is sick.
Okay.
Okay, and that person would need some form of medication before the reorientation comes, and the person can say, you know what, I think I'm a bit off. Because sometimes it's not just depression. You can have depression mixed with some schizophrenia, depression mixed with other things. And those things might prevent the person from making a good judgment that I need help and let's go for help.
Yeah.
Yes.
All right. Well, it's been a pleasure having you here today. I think we're going to have to come to an end with today's episode. We really appreciate I think we've learned a lot. I have personally learned a whole lot. I've been able to connect some dots, which is the main reason why we're doing this, so everybody can have an idea. At least this is your life. You need to be able to take charge of everything that is happening with it. So if there's something going on with your mental health, your physical health, psychological, you should have an idea. I'm not telling you to self-diagnose. I'm just telling you to pay attention of any changes that are happening with you and get help immediately. We don't sit around and wait and say it's going to pass. Sometimes it doesn't pass. By the time it passes, it's probably too late. So thank you so much, Dr. Omane Echamfo.
Yes.
I got that
Very
right.
right.
I'd like to take your final submission before we bring today's episode to an end.
Okay, so I think what I would like to say is we all need somebody. We all need other people to help us. And then we are all vulnerable to being weak at one point in time. And in our points or in our moments of weakness, we should be able to look for help, seek help. And there is help available. I mean, if you are struggling, you realize that you are going off your normal mood, your normal state of being.
Yes.
I mean, the hospitals are always open and welcome to help you, one, identify whether you are truly having a medical problem, and then help you in arriving at a proper conclusion or having a proper remedy to that problem. So don't sit down and suffer in secrecy. Open up, talk to someone, go for help, and there's sure surely there is help for you. Yes.
Well, Dr. Comforter J, you have anything to add to that?
Yes, I like to say that depression is treatable and it has very high success rates. Okay. WHO says about 80 to 90% of cases of depression are actually treatable. Okay. So don't suffer in silence, like Omani rightfully said. Talk to someone, talk to a health professional. There's nothing destigmatizing, there's nothing stigmatizing or shameful about suffering depression. It's not helpful. You're not able to function. Get help, talk to someone, see a health professional, and then get the help you need.
All right, thank you so much. And in case you're going through any phase of depression, any phase of it, to a point where you feel suicidal, I have the National Suicide Prevention Helpline here that I'd like you to write down. Maybe not for you, it could be for a friend. Somebody might need it. Then this is a toll-free number. The number is 0800-678-678. 0800-678-678. And this is the National Suicide Prevention Helpline. We'll see you again next week.
Start today, you get out tips with Dr. DALY. Yeah, giving you all the health benefits you need for your better life. Watch this show, health and life with Dr. DALY. 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 Health and life